Good morning. I'm very much fond of using compressive implants, whether it is a partially dentulous case or full mouth rehabilitation. In my practice, that is one piece basal implant practice, I use compressive implants in many areas. For example, upper nasal floor, pterygoids, sometimes in the lower anteriors, and especially in the lower posterior molar region. Here in the lower posterior molar region, I use compressive implants to engage in the cancellous bone. So here if the height is more than 10 mm, if it is 12, 14, 16 also it can place compressive implants. I usually prefer placing bigger dia, that is 5 diameter or 5.5 if the buccolingual width is good of more than 1 centimeter or 0.8 to 10 millimeter, something like that. So I always prefer placing compressive implants. So if it's an atrophied jaw wherein IAN is very close, prefer placing the lesser dia BCS, that is lingually engaged, that is to engage in the mylohyoid ridge. So many people advocate that not to use compressive implants because after the placement of compressive implants there will be a crestal bone loss. So many things going to happen, so all those things, so I don't agree with them. You can place compressive implants, but it should be with proper torque and you get good stability. When I place a compressive implant in the upper nasal floor area, I prefer placing bigger dia if the the labiopalatal width is good. I prefer placing 5.5 dia. I have placed in many cases 5.5 dia by length 23 compressive implants. I use here the drills like pilot drill followed by 2 mm conical drill, and then 2.75 conical drill. Then I go with placement of implant. So you get good stability and torque here. And I have placed many implants in the upper anterior region with only using the compressive implants. When it comes to upper posterior region, so in the pterygoid I place sometimes I place compressive implants of dia same 5.5 by 23. If I am using 5.5 by 23, just one single pterygoid, or if there is a lesser dia, if you are using like a 3.5, I will place double pterygoids. So many till technique practitioners of conventional implantology advocate that they have the opinion that we should not place 2 implants in the pterygoid region. So no issues actually, you can place 2 implants of lesser dia, that is double pterygoids on either side you can place, so no issues. Okay, so in all these regions I prefer placing compressive implants, that is upper nasal floor area, in the pterygoid region, and also in the lower posterior molar region. But one thing, keep it in mind, the torque. Okay, when you are placing lesser dia compressive like 3 mm, 3.5 mm, so you can give a torque up to 50 NCM. And if you are using bigger dia implants of 5 dia or 5.5 dia, so there you can give the torque of up to 70 to 80 NCM. So follow these protocols and you can place the implant. But one more thing what I want to emphasize here is that wherever there is a immediate extraction case followed, if there is a chronic periodontal issue is there, or if there is a periapical infection, there is a constant infection in that area, avoid placing compressive implants. So there you can place BCS implants. So I always prefer placing compressive implants wherever it suits. So I have explained where all I place the compressive implants. So along with that I place BCS implants. So this is the way I use the compressive implant in my full mouth or the partially dentulous implant placement practice. Thank you.